I'm going to talk about an interesting topic where many patients want to know before undergoing the procedure. Hi, this is Dr. Keerthana, fertility specialist at Milan Hospital, JP Nagar, Bangalore.
What is IVF?
So basically, IVF means in vitro fertilization. That means we are fertilizing the egg and the sperm outside the human body. So the fertilization process happens in two different ways. One is conventional IVF, wherein a culture dish will place an egg and surrounded by millions of sperms. And the sperm has to go and penetrate the oocyte and fertilize it. And the next one is ICSI, intracytoplasmic sperm injection. So where we will take the single oocyte and single sperm, and the sperm we inject inside the oocyte cytoplasm, which helps in fertilization of the egg. So which process to undergo? Conventional IVF or ICSI? That depends on the patient profile, individual characteristics, and the doctor, your gynecologist or the fertility specialist and the embryologist will sit and decide which will benefit the couple.
What are the steps of IVF?
So the first step is pre-preparation. So we will assess your medical history, examine you, and then know the indication for IVF. So if any medical treatment, pre-medication required before starting the actual procedure, we'll be prescribing it to you during this phase. The next step is ovarian stimulation. So your ovaries will contain small follicles which contains eggs. So we need to give certain injections daily to you to make the eggs grow. So the injections will be given around a period of 10 to 12 days. The next step is once all the egg grow, we will be taking out the eggs by after giving you anesthesia. So the next step is fertilization. So in the embryology lab, the embryologist will fertilize the eggs and the sperm. The final step is embryo transfer, wherein the embryo formed will be transferred back to your uterus, where it will implant and grow further.
IVF painful?
So the injections which we are going to give, most of the injections will be subcutaneous injections. So there is a lot less pain with the subcutaneous injections compared to the intramuscular injections which were being used previously. And also the egg pickup procedure, that means the process wherein we'll take the eggs from you, will be completely under anesthesia. You won't be feeling any pain during the procedure.
How long does IVF take?
That depends on patient profile again. So it will take approximately complete 4 weeks, including the embryo transfer, or more than that. I'm saying more than that because sometimes the embryo transfer may not be possible in the same cycle because of certain hormonal elevations or your uterine lining if it is not good. We have to defer the embryo transfer in the same cycle and has to do it in the next cycle.
Are there risks associated with IVF?
Some risks will be there, but with careful monitoring and proper treatment, all these risks can be mitigated. So the first thing is hyperstimulation, which will happen when we give injections to you to grow your eggs. By taking proper steps and giving proper injections, lower dose of injections, and taking extra measures, this can be prevented. And the second one is multiple pregnancy. By doing a single embryo transfer during the embryo transfer, this can be prevented. And next one is ectopic pregnancy. Rarely happens in IVF, during IVF procedures.
What lifestyle changes can improve IVF success?
Regular physical activity will definitely help in improving the success rates in the IVF. The next thing is proper diet. Diet management and nutritious diet, high protein, low carbohydrate diet also helps in improving the success rate and also reduces the need of the dosages of injections also. Regular yoga, meditation and peaceful mind is another thing which plays an important role in IVF success. Thank you everyone for your patient listening. If you have any more doubts, you can contact us at Milan Hospital, JP Nagar, Bangalore.